Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Wound infections. So first is the infections that occurs up to 30 days and after the surgery or up to 30 days after the surgery in patients receiving the implants. Then it's affecting either the incision or the deep tissue or the operation site. Next is the Southampton wound grading system. So what is the Southampton wound grading system? So this includes 0 to 5. The 0 means it is normal in appearance. Then 1 stands for the normal healing with mild bruising and erythema. So normal healing, and this is with the mild and bruising erythema. Next is the subtypes and appearances, that is 1A, B and C. A means it is a some bruising is present in A, and then B means considered bruising, while C means mild erythema. Next is 2. The 2 means there is erythema plus other signs of inflammation. So erythema and also signs of inflammation. So what are the subtypes? Subtypes, it includes A, B, C, D. So A stands for 1 point and B stands for around the sutures. C stands for along the wound and D for around the wound. So at the point, around the sutures, along the wound as well as around the wound. Next is 3. The type 3 is where there is a clear or hemoserous discharge. So clear or hemoserous discharge. And there is 3 A, B, C, D, and A stands for at point only less than 2 centimeters. And B is where it is greater than 2 centimeters. C means it's a large volume. And looking at D, it is nothing but prolonged. Next we move on to the grade 4. The grade 4, it stands for the pus, and this is again for A and B. A stands for at 1 point only less than 2 centimeters. So less than 2 centimeters. And then comes B. B is along the wound. That is greater than 2 centimeters. Now let's look at sepsis score. So sepsis wound score, it includes there is a scoring system to assess the severity of the wound infection. So the components of sepsis score, it includes A for the additional treatment and indulging in antibiotic therapy for the wound infection, drainage of the pus, anesthesia and debridement of the wound under the general anesthesia. Next is S for the serious discharge and erythema, E for erythema, P for purulent exudate and separation of deep tissues. I for isolation from the wound and P for the prolonged hospital stay. Exceeding 40. To learn and grow daily like this, please do subscribe.